All right, everyone. It is now 3:30 Central Time. I am so excited to have you here for today's edition of our free webinar, our Next Gen Nurses free webinar series. We're talking about miracles in motion. We're talking about the nitty-gritty of maternity nursing, whether you love it, whether you don't. I am so excited that you are here. So, without further ado, what I want you to do is I want you to let me know in the chat, how do you feel about maternity nursing? There's no right, there's no wrong answer. I'm just curious, how do you feel about all things maternity? I'm saying not good. That's okay. Two patients is a lot to handle. Okay. I love maternity. Yes, me too. Not great, nervous, still need some review. Need to know vitals by heart, 50-50, love it. Massage the fundus when in doubt, unless the lady is pregnant. Yes, I hear you. So, maternity nursing is my passion. So, if we've never met before, my name is Jennifer Bonner. I've been a nurse for 15 years. I have done everything from stroke ICU to endoscopy, what I lovingly refer to as the butts and guts of the hospital. And I landed in labor and delivery and postpartum, where I found my passion for nursing. So much so that I got a master's in family practice and thought, I really, really love this aspect of nursing. So I went back to college, got a master's in midwifery, became a certified nurse midwife, and finished my doctorate shortly after that. I worked in a private clinic for about 4 years before I transitioned into education. So I've been with Archer for 2 years now, and I serve as the tutor team lead here at Archer Review. And I absolutely love what I do. I work one-on-one with students, private tutoring, small groups, um, free webinars. So that's where I live. And I am just so excited that you are joining me today. So, just a few housekeeping rules, housekeeping things before we get started. I just want to make sure that we understand where to put our questions. So, if you have a question that you need answered, please go ahead and put that in the Q&A, and I will try to get to those just as fast as I can. If you are just you just have a question, or you're responding to something that I've said, please go ahead and put that in the chat. So, just like where you put how you feel about maternity, that's where you put your answers to questions that I have, unless we're using Slido. Um, and that's where we can kind of do some discussion there. All right. So if you've ever joined one of um, our free webinars before, you probably already know what question I'm going to ask, but where are you joining us from? So go ahead, jump into slido.com, and you can enter in the code maternity with Archer, or you can take your smart device. Go ahead. Whoa, smart device. Go ahead and scan that QR code there on your screen, and that will get you right into our poll as well. So go ahead. Let me know where you joining us from. I'm joining you from sunny South Dakota right now. We just got done with some really frigid temps, had a beautiful weekend, and now it's gorgeous outside. David, my NCLEX is in 2 days. Last minute tips. Yes. Take tomorrow off. Take tomorrow off. Enjoy the day. Do everything you can to prepare for exam day. So have your keys, your wallet, all those things ready to go. Know where you're going. All right. Seeing Houston, Texas, seeing Philippines, California, New York, Canada, California, Toronto. Wow. We have people from all over the world, which is awesome. Bahamas, Boston, Massachusetts, Ghana, Fort Myers, Alabama, Hawaii, Winnipeg. Awesome. We are so glad that you are here. So excited to have you here. So, someone is asking, with SurePass, do I have access to these live recordings? So, our free webinars are actually going to be available to you on our Facebook page and our YouTube channel. They will be recorded and there for you. So go ahead, like, subscribe. If you're joining us on um, our other platforms like TikTok or Instagram, please don't hesitate. Go ahead, share this with your friends. Make sure that they know they can get some support here too. All right. So if you have ever been a part of a maternity ward, you know that it's very fast paced sometimes. So we're going to go ahead and meet our client. So we're going to go through a little bit of a case study today and see how we can use the information that we already have to apply to our client situation. So we have Mrs. Jones. She's a 31-year-old female. She calls her OB and says she thinks she is pregnant. She had a positive pregnancy test at home and she's really tired and she has very little energy. So we're jumping back into Slido and I want you to tell me what sign of pregnancy is a positive pregnancy test? Is it presumptive? Is it probable? Or is it positive? So think through. We have those three different types of pregnancy signs: positive, probable, presumptive. Which one does a positive pregnancy test fall into? What do you think? What do you think? I'm seeing probable, I'm seeing positive, I'm seeing all three. Okay, this is great. So let's go through what those actually mean. So when we see presumptive, I want you to think we presume. So these are things like an absent period. They're feeling really tired. Their breasts are sore. Now, when we look at this list of signs and symptoms, there's something that they all have in common. They can be caused by a lot of other things, right? So somebody let me know what could cause a absent period. What could cause an absent period? What do you think? And then you can put those in the chat if you're joining me on Zoom. Stress, a lot of exercise, birth control. Yeah. Hormonal irregularity. So something like polycystic ovarian syndrome. Absolutely. You got it. Nice job. So, what could cause somebody to be really tired? Being in nursing school, life. Yes, absolutely. So, there are a lot of other things that can cause these presumptive signs of pregnancy. Now, what about our probable? When I think probable, I think they are probably pregnant. There's not a whole lot of other explanation. So, like a positive pregnancy test. Occasionally, we will see certain cancers that will turn a pregnancy test positive. But for the most part, if a pregnancy test is positive, they are probably pregnant. We have this thing called ballottement. So when we as providers do an exam, if we tap on the cervix, the fetus, if they're big enough, they're going to float up and come back down. That's called ballottement. We can kind of feel the outline of fetus in there. Now, there are times when we have something else, like a growth or a tumor of some sort that we might be feeling, but chances are, if we're feeling something in there, they are probably pregnant. So we have probable, we have presumptive, now we have positive. Now, this means there is no other explanation. I am absolutely positive that this is a baby. So if the provider is feeling fetal movement, we've detected heart sounds. Now, this could be through ultrasound or that little Doppler that we use, or if we see the baby on an ultrasound. Those are all things that tell me 100% this lady is pregnant. Now tell me, now that we've gone through those, which one of these does a positive pregnancy test fall into? Is it presumptive? Is it positive? Or is it probable? Which one do you think? Probable. You got it. Because there could be something else that could turn that pregnancy test positive. So it's not a positive sign of pregnancy, it is a probable sign of pregnancy. Great job. All right. So the nurse asked Mrs. Jones, when was your last menstrual period? And she says it was 10, 25, 22. Now, somebody let me know in the chat, what do we use to calculate the due date, the expected due date? There's a specific thing that we use. It's a type of rule. Nagel's rule. You got it. So with Nagel's rule, we're going to start out with the first day of the last menstrual period. So 10, 25, 22. We're going to add 7 days. We're going to subtract 3 months, and then we're going to adjust the year if needed. So this is one of my very favorite things to do. I absolutely love this. I'm a little nerd when it comes do that. So let's break this down together. So her last menstrual period was 10/25/22. So we're going to add 7 days, so 26. Well, first of all, we need to know how many days are in October. So I think 30 days have September, April, June, and November. All the rest have 31, except for February that has 28. So there are 31 days in October. So October 25th, 26th, 27th, 28th, 29th, 30th, 31st, November 1st. That's adding our 7 days. And then I'm going to subtract 3 months. So I'm going to go from November to October to September to August. So that gives us August 1st of 2022. And then we need to adjust that year. So that gives us August 1st of 2023. Now, I have a question for you. We're going to jump into Slido here really quick. And I want you to tell me, would this be any different if her last menstrual period would have been in January of 2022? Would the year be any different? Would I be 2022 or would I be 2023? What do you think? What do you think? Okay, I'm seeing some yeses. I'm seeing some 2022. Okay, so think about it. If her last menstrual period was in January and we count ahead 9 months, what does that give us? That gives us September of the same year. So we have to be a little careful when we're looking at changing the year when it comes to Nagel's rule. Excellent job. All right. So when we have that first trimester, we know that there's a lot of things going on. There's a lot of rapid development, right? So we have that fertilized egg, it's growing. We have the heart tube that forms, facial features that are coming, and that neurotube is well developed. Why is it important for us to know that that neurotube is well developed during the first trimester? What would be important for us to think about when it comes to the neurotube? What do you think? Folic acid, Savannah, you got it. Absolutely. It's really important for us to be reminding our clients, hey, you should be taking some folic acid. Ideally, we want them to be taking that before they get pregnant. So after that 8th week, we call the baby a fetus, which is really exciting instead of calling it an embryo. We have hands, arms, fingers. All of those are fully developed, and they're starting to figure out how they can open and close all of those things. Excellent job. So someone was asking for probable signs which are detectable in that first few weeks of pregnancy. So probable, they are probably pregnant, is going to be things like your positive pregnancy test. Awesome job. All right. So we need to calculate Mrs. Jones' GTPAL. She says that along with this current pregnancy, she has a history of a healthy delivery at 38 weeks, an emergency C-section at 29 weeks where the child did not survive. So what do you think Mrs. Jones' GTPAL is? Let me know in the chat. What do you think her GTPAL is? You can take a minute, think through it. Okay, I'm seeing some G3s. We're going to talk through GTPAL here in just a minute. Okay. I'm seeing some great answers coming through already. Excellent job. So let's talk about this for just a minute. Gravidity. Gravidity is the number of times that a person has been pregnant. Now, remember, when we're thinking NCLEX, a lot of times they're going to try to trick you and tell you she's here for a prenatal visit. So that lets us know that she's currently pregnant, right? So make sure that we count the current pregnancy and then all of her other pregnancies as well. Now, what is T? T stands for term. Now, we know that term goes from 37 weeks to 40 and beyond. In theory, to 40 weeks. Okay, not 36 weeks and 6 days, but 37 weeks gestation. Okay. And here are twins. They only count once. We'll talk about where they count for more than that. But when it comes to term pregnancies, they're only going to count once here. Now, what's preterm? Before we get to there, somebody tell me what weeks are considered preterm. Let me know in the chat what weeks are considered preterm. You guys are doing an amazing job. Okay, I'm seeing some varying answers. So preterm is considered anywhere from 20 weeks to 36 weeks and 6 days, or you might hear it called 36 and 6. So if we are 19 weeks and 6 days, we are not preterm. Okay. So preterm is from 20 weeks to 36 weeks and 6 days. Okay. And this is the number that she's had. Twins, again, we're only counting once here. Now let's talk about abortions. Abortions can be a little bit difficult to understand because in this case, when we're talking about abortion, when it comes to these numbers, we want to know how many pregnancies ended before 20 weeks. So 19 weeks and 6 days and previously. Now, this could be spontaneous, like a miscarriage, or it could be a termination of pregnancy. Okay. So if the abortion or the miscarriage happens after 20 weeks, guess what? It's counted in the preterm. Okay. Now, what about living children? This can change from year to year. This is the current amount of children that they have living. And this is where our twins count as two. Okay. So when I was working in the clinic, I had women that would come in for their well woman visit. They would tell me, hey, yep, I have 3 living children. But the next year, I had a client that lost her little girl. And so her living number of children actually changed from visit to visit. So this one can change a little bit. So preterm is from 20 weeks to 36 weeks and 6 days. Abortion is considered before 20 weeks, so 19 weeks and 6 days and previous. So let's figure out, what is Mrs. Jones' GTPAL? So we know that she has 3 previous pregnancies. This counts in her numbers too. So she's had 2 previous at that 38 weeker. She's had no abortions. And she had that emergency C-section at 29 weeks. So that's preterm. And that child did not survive. Current living is 1. Okay. Any questions about that before we move on? Okay. Excellent. Excellent. Okay. So Mrs. Jones, she's a little bit nervous here, and she has some questions about her nutritional needs. So what kind of things are we going to talk about when it comes to nutrition with Mrs. Jones? Michelle, I'm happy to repeat. What was it that you needed me to repeat? I'm happy to do that. So what kind of things are we going to let her know? We want to talk about iron, okay? So making sure she's getting good dietary iron so she doesn't become anemic. Sure, Bina, go ahead and ask your question. I'm happy to help. Prenatal vitamins, risk for gestational diabetes, mercury, very good. Prenatal vitamins, no cleaning the cat litter pan. Yes, you got it. Nice job, Savon. Folic acid, that's a big one. Sure. The answer to the GTPAL is she would have been a G3, T1, P1, AL1. So someone is saying because the child didn't survive, would it count as abortion? No, it would not, because it was at 29 weeks, which is after that 20-week mark, and abortions are before 20 weeks. Great question. Okay, so let's talk about what type of nutritional needs we are going to be considering here. So we want to talk about what her nutrition should look like. What should you be consuming? So we know that our caloric needs go up as our pregnancy progresses. So if a woman starts pregnancy underweight, we want her to be aiming for more like 400 to 500 calories daily, an additional 400 to 500 calories daily, while somebody that's overweight, only about 200 extra calories a day. Okay. We want to make sure she's getting good protein. She's getting healthy fats like avocado. Really cautious when it comes to those fish that are high in mercury. We also want to talk to her. Is there any other supplements she should be taking? Folic acid is a big one. We would prefer them to be taking this before they get pregnant. Remember, that neurotube is really developing during that first trimester, and folic acid helps to prevent those birth defects like spina bifida. Okay. Calcium supplements. Now, wait a minute, just a second. Folic acid. What if she has multiples? Do we want her taking more folic acid or just the normal amount? What do you think? What do you think? So we're actually going to have a higher dose if she has multiples. We want her to make sure she's getting good calcium. So that's good for bone strengthening. Vitamin D, again, helping with bones and teeth of that fetus. Iron is going to help with that blood and oxygen carrying capacity. Very, very good. Now, what about when it comes to foods? Now, there are certain foods that we need to avoid in pregnancy. Fish high in mercury. Many of you had that one earlier. Those are things like shark, swordfish, okay? King mackerel, tilefish, things like that. We also want her to avoid cold deli meats. Now, it's totally fine for her to consume deli meat, but we want to make sure that it's cooked to the point where it's steaming. We know all that bacteria is gone. We don't want her taking unpasteurized dairy products, making sure she's washing her produce. And we recommend it's okay to have some caffeine during the day. We say just about a glass a day is totally okay. Now, why no pate or liver? Well, these are really high in vitamin A. And what can that do? That can cause congenital defects in the cardiac system, the CNS. So we want to be really, really careful. And it can actually increase the risk of that spontaneous miscarriage. So we want to be very careful with those. Also, alcohol. We don't know how much alcohol does damage, so we generally tell women to avoid it during pregnancy. Now, is maternity something that you struggle with? It was definitely one that was a little bit more difficult for me. Tends to be something that you really like or you really maybe don't prefer it. And a lot of times we do better in those areas that we really enjoy. So if this is an area that you're struggling with, please go ahead, scan our QR code, check out the availability of our tutors. These women are amazing when it comes to helping students find their deep potential, helping them to identify areas where they can improve, and also encouraging you in your walk. So if you are struggling with any of these areas, whether it be maternity, mental health, pharmacology, please don't hesitate to reach out to us. If you can't find something that works for your schedule, please reach out to us at nclextutors@archerreview.com, and we're happy to help. All right. So 2 weeks later, Mrs. Jones calls and she says, I can't keep anything down, including fluids. What are we concerned about is going on with Mrs. Jones? What do we think she has? What do you think's happening? Someone saying maybe she has some parasites in her food. Hyperemesis gravidarum. You got it. That's right. Now, what is this? Now, it's not the same as morning sickness. Morning sickness is typically less traumatizing, but typically they're able to keep some things down. The vomiting, if they have it doesn't typically cause dehydration. Now, hyperemesis gravidarum is we have this persistent excessive vomiting to the point where we are having some issues with electrolytes. Maybe they're losing some weight. We don't want them losing weight during pregnancy. They can't keep anything down. So this is when it's really important for them to let somebody know. Now, when are we concerned about hyperemesis gravidarum? That's a great question. I'm glad you asked. Now, if they're losing weight, I'm absolutely concerned. If they're dehydrated, I'm concerned. Why am I concerned? dehydration. Why would I be concerned about dehydration in a woman who's pregnant? What do you think? Thank you so much for those of you who are tagging your friends and sharing. Awesome. So she is also providing blood for the fetus, right? For the baby. So we want to make sure that she's adequately being able to perfuse. So we want to make sure she has plenty of water on board. She's adequately hydrated. Now, when we're persistently vomiting, we can have issues with our electrolytes. So dehydration can lead to hypernatremia. Too much vomiting can lead to things like hypokalemia, hypochloremia, because we're getting rid of so many of our electrolytes. So that is when I'm concerned. So what are we going to do about it if she has hyperemesis gravidarum? Well, we're going to try with some kind of prudent things first. We're going to try some dietary changes. Maybe having some crackers in the morning before she small sips of liquids throughout the day, in between her meals, not during her meals. Small, frequent meals throughout the day. And then making sure that she's sitting up after meals. All of those things can help. Even using a straw with your fluids can be helpful because you are able to more so control the amount of fluid that's in. Now, if those things don't work, we start to look at medications like promethazine. Now, typically, this is when we start to consider medications, is when their symptoms are so severe, it's really impacting their pregnancy. And promethazine is in our class of medications called our antihistamines. It's been used for a lot of years to treat nausea and it has a relatively long history of its use. Generally, we consider it safe when we use it appropriately with medical supervision, but it's not without its potential side effects and risks. So it's really important that women understand what those are. If that's not helpful, sometimes we need to do IV fluids, and in rare, but there are times when we need it, we may need to hospitalize in order to give TPN. So that is hyperemesis gravidarum. Mrs. Jones is having a really hard time during her pregnancy, but we were able to talk her through what her options are for managing this nausea and vomiting. We were able to just manage things with some diet changes. She was able to do small, frequent meals throughout the day, do liquids in between those meals, and that was sufficient. So we were able to adequately care for Mrs. Jones. So someone is asking, what is TPN? It's that total parenteral nutrition. So it's nutrition that goes through the veins. Great question. Okay, so what if you're sitting there and you're saying, Jennifer, I'm trying to study for the NCLEX. I'm really overwhelmed. I have no idea where to start. Let me recommend our SurePass combo. This is the number one thing that I recommend for students that are like, I don't know where to begin. This includes all of our on-demand videos on just about any subject you can imagine. We break it down in an easy to digest way. You have access to our Q bank with over 2,000 questions for registered nurses, and you get access to our 3-day live. Now, our 3-day live, 3 days of action-packed information on those high-yield topics that you're going to need to pass your NCLEX. We typically recommend that students take this just before they're getting ready to take their exam. Now, this month's 3-day live actually is going to be happening this Wednesday, Thursday, and Friday. And you can find that on our website if that's something that you're interested in. You can actually purchase the 3-day live on its own. I believe it's $59 or around $50, or you get that in the SurePass combo. The 3-day live does come with its own ebook, and we're going through those high yield content areas. So someone is asking, is it overwhelming? This is used to be like a last minute, let's make sure we have all of our ducks in a row as we're getting ready to take our exam. So it's a great opportunity to find out, do we know what we should know, and making sure that we know what are those high yield topics. So someone is asking, my NCLEX is on the 14th. Would it be bad to take the 3-day live this week? Absolutely not. That would be a great review for you before you jump in. So remember, Archer Review, we are here for you throughout the lifespan of the nurse. If you're getting ready to go into nursing school, if you're in the middle of nursing school, if you are getting ready to take your NCLEX, practitioner, we have something for everyone. So please don't hesitate to reach out for us. Reach out to us. We are more than just NCLEX prep. We are here for you. We want to invest in your journey through nursing, whatever that may look like. We're here to support you. So thank you guys so much. Don't forget, this will be available for you on our Facebook and our YouTube channel. Please don't hesitate to share with your friends. And we look forward to either seeing you at our 3-day live this week or back here on Monday for our next free webinar. Thank you guys so much.